Welcome back to the Cowboy and the Queen. Today, super excited about this one. We're going to talk about hormone replacement therapy, right? HRT.
Yep.
So let's just dive right into it, darling. What is hormone replacement therapy? What is it?
So, hormone replacement therapy is probably the most incredible thing that's ever happened to me. And it really helps hundreds of patients every single day. But hormone replacement therapy really is what improves symptoms as we go into that naturally decline with our age, that help improve symptoms like fatigue, low libido, weight gain, brain fog, mood changes, sleep disturbances. And and the goal of hormone replacement therapy isn't to make someone superhuman, although patients that are on it sometimes feel like they're superhuman, but it's to restore balance so the body functions the way that it was designed to function.
First question. How do you know if your hormones are off?
So, you're going to trust your symptoms. So, common symptoms that we see are irritability, hot flashes, weight gain, insomnia, just not having any energy, poor recovery from workouts, hair changes, skin thinning, loss of libido. Many people just assume these are part of the aging process, but they often signal that there is a hormone imbalance. And so, blood work, doing a full hormone panel is hugely important to kind of know, your baseline of where you are. And then we don't just look at labs, but we also look at how the person's feeling and those symptoms that they
But
present.
but what labs matter most too?
Well, it depends on male or female,
Okay.
but we're going to look at all of your sex hormones. We're going to look at your thyroid. And so we're going to just do a comprehensive panel to see exactly what all your sex hormones are doing, what your thyroid's doing, and we'll have a good baseline of where to start. And then we're going to do a comprehensive patient intake form and survey the patient on just those symptoms that we talked about that continue to come up in patterns like I'm not sleeping, I'm having night sweats, I'm having brain fog, I don't have any energy, I'm not recovering from my workouts as well. And so we're just going to have an open dialogue with patients after we run their labs, and then we'll know, exactly what hormones what they're needing. And so
Which ones exactly?
yeah, exactly. So a comprehensive panel includes things like looking at estrogen, progesterone, testosterone, free testosterone, and DHEA, FSH, LH, thyroid panel, doing a full thyroid panel, looking at cortisol levels, looking at inflammatory markers, and just looking at a full evaluation to ensure that we're treating the root cause and maybe what's causing these labs to be out of whack. And then we also want to treat those symptoms as well.
And then kind of like we talked on our last podcast too, is about like GLP-1s and, different types of GLP-1s and how there's so many out there and which ones to get and which ones not to get, They asked right here, what types of HRT are available?
So there are different types of hormone replacement therapy. There's pellets, there's injections, and then there's creams and gels. And so pellets are going to be more of those long acting hormone replacement therapy or HRT.
Would it be more longevity, would you say? Like, I know this is your personal opinion. I know
It's longer acting.
Okay.
And for me, it's the most convenient way. But I
Okay.
have patients that do creams, injections, and pellets as well. So we can do what the patient really wants. Pellets are great for people that don't want to have to take something daily.
Every day.
Every day.
Right.
And for myself, for example, I do so many injections for peptide therapies. I don't want to have to remember one more thing. So pellets are just reasonable for me, and I travel. And so it just is easier for me. And then injections are going to be something that is very precise, something that you can titrate a little bit easier, and excellent for people who really want that full control. And then creams and gels are gentle, they're flexible.
What's your thoughts on those?
They're messy.
Okay.
They're very messy and
me.
they're messy. And also, we don't know, dosing tends to be a little bit more of a concern because we don't really know how much we are absorbing when we take those transdermally. And so that's just my opinion. Patients that think they might be sensitive to hormones or they're unclear if they want something actually in their body, sometimes this is a good place to start. And then once they're comfortable with how their body reacts, then we move them into a more of a long-term solution like pellets.
Oh, question I have for doing the pellets, how long do you think that lasts over the course of time? Do they have to do this every 6 months? Do they do it once a year? Do they,
You
what,
know,
from what you're seeing?
4 to 6 months is typically what we see when we're talking about pellet
Okay.
dosing. Typically, patients feel a lot better at like that 6 to 8 week mark. And so, if someone's on the journey for, let's say, hormone replacement therapy pellet patients, we will draw their labs, we'll get the results, we'll implant the pellets. And then 6 weeks post implantation, we'll have the patient come back to run more labs to see if their levels are optimal, right? And then I hate to say come back in X amount of time or Y amount of time because we really want the patient to come back based on how they're feeling. And so for you, it may be 6 months. For
Right.
me, my burn rate, it may be 4 months. And
Right.
so it's important not just to do it cookie cutter every way, but we want, to do something. We want to make sure we're running the right labs. We want to make sure that we avoid these cookie cutter protocols and that we're monitoring these labs every 3 to 6 months and that we're getting these medications from really good pharmacies.
You're taking care of the patient. You're taking care.
Complete comprehensive patient care.
Exactly.
Yes,
That's so darn important.
it is. And you have to measure labs. And I always tell patients, there are hormone um, practices that really push the limit and the envelope on levels. And we don't do that. And my goal with patients is dose low and slow. You'll hear me say that over and over and over again.
Yeah, no, that's
So you may not feel superhuman, but you won't have the side effects or the potential side effects that you would have if we do too much too quick. And it's funny because there's kind of two camps with hormone replacement therapy. Like my OBGYN is very traditionally trained,
okay.
right? And when I first told her that I started pellet therapy many years ago, because um, I had COVID and COVID put me into full blown menopause. And we'll talk about that in a minute.
Okay.
So I went through menopause at 43, very young to go through menopause, but I knew something was not right. And so I went to my hormone replacement therapy physician. We ran some labs. He was absolutely certain, yes, you are in full blown menopause. And so then I went to my gynecologist for my annual pap smear. And she said the most crazy thing to me, Wyatt. And I still, every time I think of her, I think of what she said. She said, you are going to grow a beard, gain 10 pounds of water weight, and you are going to grow hair all over your body, and your Adam's apple is going to get bigger. You really should not do hormone replacement therapy. And I said, well, that's interesting because I've had none of those symptoms happen to me. And what would be your solution? And she looked at me with a straight face and said, I would throw an IUD in you and call it a day. And so instead of fixing the root cause of the problem and giving me what I needed to function for my body to function optimally,
Mhm.
she was going to throw a foreign body in me and make that just produce exogenous hormone instead of fixing the issue. And so
I mean, because I don't want you to grow big.
Houston, we have a problem. Well, I have not grown a beard,
No.
Wyatt. But I will say if patients are dosed too aggressively, they can gain 10 pounds of water weight. They can get facial hair. They can lose the hair on their head, especially females. And so we just really want to be savvy and really monitor these patients very closely.
Great question here. HRT for women. What is the real goal on that? I know you talked a little bit about that, just like you explained there as well. And then also they said HRT for men. It's just not testosterone.
No, absolutely not. So, you know, for the goal for women is during perimenopause, we start to see these hormone influxes with our estrogen and testosterone. And probably most women are low in the testosterone levels probably anyway. And so estrogen and progesterone starts to fluctuate during perimenopause and then they start to drop. And what happens then is we start getting mood swings, hot flashes, weight changes, having sleep issues, skin dryness, cognitive fog. And so, what hormone replacement therapy does is it smooths out these fluctuations and improves the quality of life, which makes people, I always say, to live well is to die well. And so, when we fix these issues, we support long term health. And so And some patients think, I don't want to do this. This is dangerous. And, my levels look fine. And I always tell them this when you are looking at someone's labs, they throw, if you are within the range, whether it's very, very low end or very, very high end, that lab report is putting everybody that is age 20 to age 80 in that one range. So we want patients to be on the high end of functioning, right? And so there's just no reason that patients in 2025 and 2026 have to suffer with these
Right.
symptoms and think this is just part of my journey
This is how
going
life's
through
gonna be.
menopause.
This is how life's gonna be.
Absolutely.
You don't have to.
And for men, what does low testosterone look like?
Mhm.
Fatigue,
Mhm.
decreased motivation, decreased libido,
Sleep,
weight gain,
okay.
sleep, mood changes, and changes in lean muscle mass. And you know what? You guys need estrogen as well. And so, if you have too high of estrogen or too low of estrogen, it can create symptoms. And so, HRT is just about harm. It's about harmony. It's not just about boosting testosterone
Right.
levels.
Yep.
So,
Question we just got right now is hormone therapy safe?
well, yes, and the FDA had to come out a couple weeks ago and
Mhm.
say remove their black box warning saying that hormone replacement therapy causes cancer. And what a damn shame because for 20 years or longer, patients, women especially, have chosen to suffer because their primary care physicians told them that if they got on hormone replacement therapy, they would get increase their risk of getting cancer. And we now know that we have been lied to. And so the sad part of this is how many women then sought for SSRIs for being depressed and having anxiety? They haven't been sleeping, they have low libido, and they've just been really functioning at such a lower capacity than they needed to. And so, hormone replacement therapy is safe, especially modern hormone replacement therapy, because when dosed appropriately and monitored regularly, it is considered safe for most people. And risk is really going to depend on the individual. And that's why it's important that they are assessed by a trained provider. And those outdated studies and those fears really came from synthetic hormones at much higher doses. And those just aren't commonly done
Right.
anymore. That's just old
I know.
school information.
It's just, it's all that BS that's out there, which, well, we don't do BS here.
Right, right.
Question here. This is, and you've kind of touched on this a little bit
Okay.
as far as like, how do hormones, affect aesthetics, right? So of course there's probably going to be with the hair and skin less,
Yep, yep. So absolutely. Hormones boost collagen. They improve skin elasticity. They enhance fat metabolism. They regulate inflammation, support hair growth, improve sleep, which are all very powerful anti-aging tools. And so it really, like we said earlier in the podcast from last week, is when the body functions better, people look better and
right.
age more gracefully, right? And so, absolutely, it's one of the most powerful anti-aging tools that is available.
I love it. I will say I have done the pellets and it definitely has helped me out and con- combining it, doing it some peptides as well. I'm excited about doing that as in moving forward here in 2026. Okay. What results should people expect?
So, you will see changes in your mood, improved sleep, decreased brain fog, better mood, clear thinking. Within 4 to 6 weeks, you'll definitely start to
That's what I was
feel
gonna
some
ask.
of these
How long does
changes.
that take usually for folks to start really seeing or feeling the results
Four to
of it?
6 weeks. I think if we're talking about skin deep results, estrogen for women takes longer to see improved skin quality.
Okay.
So maybe 3 to 4 months for that. But for patients to feel better,
Yeah.
they're going to see changes in 4 to 6 weeks, which is pretty impressive.
Do you think that's the same for men and women?
100%.
Probably the same? Okay.
100%.
I was just like,
For sure.
and here's a big, big, big topic.
Yes.
What we talk about. How do you choose the right provider?
Well, it's tricky, especially since
Tricky.
we reached to TikTok to choose our medical provider and
I
what we're
know.
thinking is really true in medicine these days. So, Dr. Influencer, just kidding. We want someone that orders comprehensive labs. We want someone that uses not just pellets, but has options for patients depending on, what they feel comfortable doing. You want someone that avoids these cookie cutter protocols. You want someone that's going to monitor your labs. You want someone that uses good products, especially when you're implanting them in your body. So you want someone that partners with accredited 503A and 503B pharmacies.
Important. I'd say that again.
We can get in the weeds as
Right.
far as even how a pellet is made. It is important when you're even choosing a pellet pharmacy to find out what kind of fillers or binders are used when compressing this pellet
Mhm,
together.
mhm.
Because what you don't want is a pellet that has a soft center.
Right.
And what that means is, so a patient gets the a pellet implanted, right? And they feel good and they feel good and they feel good. Well, the whole time this pellet is in the body, it's just slowly feeding the system medication. But if it's not a quality pellet, when it gets to the center of that pellet, it has what's called a soft center. And when that happens, it releases too much into bloodstream too quickly. And I think that's when we can see that uptick in side effects. So
Okay.
it's very important to know what you're putting in your body
Absolutely.
for sure.
Awesome stuff. Awesome stuff, Missy. Thank you. And then, we've kind of went over all this because we've got to cut it off. This is the last question we have here today. You know, you've kind of spoke about this.
Yep.
What's the first step if someone does suspect hormone imbalance? But like I said, why not go get evaluated? Why not go
100%.
checked out? Why
100%.
not do it?
I think it's important to go to someone that's going to not cut corners, running a full panel of labs because you don't want to guess, right? This is not something, your hormones are the control center of your body,
It's your life.
right? It is your life.
Yeah.
And so we want to see as much information as we can so we can make the best, most personalized plan based on the information that we have. And so once you're evaluated, then, I talk to patients about their symptoms and we spend a lot of time creating a plan. And so we want a plan that's going to dramatically improve the quality of life for patients and also give them those long-term health benefits that are associated with having optimized hormones because it it is really the key and is the fountain of youth to feeling younger and looking better long term.
I love this. This is so awesome listening to you. I mean, like mind blown. I love this, and I hope y'all and thank y'all for reaching out and these questions. These questions are all fantastic. I just want to say thank y'all again for tuning in to the Cowboy and the Queen, and we can't wait. Just y'all wait for the next one coming up to theater and y'all.
We'll see you next week on Cowboy and the Queen of Aesthetic.
Bye, y'all. Thank you.